Did you know that before we had the Tdap vaccination, also known as diphtheria, tetanus, and pertussis, or whooping cough, it killed thousands of children every year? And even today, without vaccination, babies and young children can still suffer from complications associated with these diseases, such as breathing problems, problems with their brains, and heart failure, or even worse. So, why should we care? Well, these diseases, even though they're still rare, not because they disappeared, but because we have vaccines, means that DTaP is one of the most important vaccinations for your child. This vaccine is part of what we call the Series 7 vaccinations. So these are the 7 most important vaccinations that your baby can receive between the ages of 0 and 24 months. This vaccination requires a total of 5 doses over the course of that time period in order to confer full immunity against these potentially deadly illnesses. The DTaP vaccination protects against very serious illnesses and diseases. So let's go through each of them together. The D stands for diphtheria. This can cause a thick coating in the throat and can block the airway and make it very difficult for your child to breathe. Next, we have tetanus, also known as lockjaw. It enters in through a cut or a wound, which is why, as adults, if we step on a rusty nail, we also have to get a tetanus vaccination. But it's even more important for young children because it can cause painful, intense muscle spasms, and without treatment, children can die. And lastly, we have pertussis or whooping cough. This particular infection is respiratorily transmitted and again causes breathing problems and an intense whooping like cough that can cause a strain on your baby's ability to breathe and unfortunately can also result in death. Here are a few quick facts around the DTaP vaccination. Number one, it's safe and effective. Number two, it's often provided in addition to other childhood vaccinations. Number three, the side effects of this vaccination are typically mild and may result in some injection site pain or irritation, but typically go away within 1 to 2 days. And last but not least, there are in some instances some rare side effects that do exist, but always remember to talk to your child's pediatrician if you feel like they're experiencing any adverse effects from the vaccination. Also, what happens if your child misses a dose? No big deal. But as much as possible, we do want to encourage all parents to try to stay on track with the routine recommended vaccinations and what we call on time vaccination. So, if you do miss a dose, no worries. Just come on in and we'll go ahead and vaccinate you as if you never missed a dose. It's always okay to come late, but it's not okay to come early. If you come early for your vaccination, it may not count and you may have to get an additional dose. So, if you know anyone else that could benefit from this information, please make sure that you tag and share. We are VaxFax NV. Happy immunizing!